World's first clinical trial to use psilocybin to treat generalized anxiety disorder has been approved in Australia.
Here's a summary of the article.
Australian researchers are gearing up to kick off the world's first study into whether magic mushrooms can help treat general anxiety. They'll be using specialized therapy along with psilocybin to see if this winning combo can help reduce the effects of anxiety. Monash University head of clinical psychedelic research Paul Lichnitsky is leading the trial and said this is an incredible step forward in the fight against mental health disorders. For the first time ever, we're able to provide supported psilocybin sessions to research trial therapists to better equip them to accompany our clinical participants through profoundly unfamiliar terrain, potentially improving treatment outcomes. Paul Lichnitsky told The Age late last year that the current approaches to mental illness are often unsuccessful, but added that psychedelic-assisted therapy could be effective in treating such illnesses. Mind Medicine Australia wrote on its website, the rescheduling would move these medicines from Schedule 9 of the Uniform Scheduling of Medicines and Poisons to Schedule 8. The rescheduling will enable psychiatrists and specialist addiction physicians to more easily access these medicines to augment therapy for patients suffering from key mental illnesses such as depression, PTSD, and for the depression and anxiety often associated with a terminal illness diagnosis.
This post received a score of 10,000, with an upvote ratio of 97%. Here are the top comments in response to this article.
As someone with diagnosed generalized anxiety who has used mushrooms, LSD and peyote, I confirm that it helped me frame my disorder in a way that allowed me to live my life without constant crippling anxiety about everything. It allowed me to get a job, find a wife, and interact in society in ways that probably wasn't possible.
How often did you take it, and were you using when achieving the above goals?
As someone who takes it between 3 to 4 times a year, I usually take it every few months or when I feel like I have some struggles I'd like to think through. I do think it has helped me quite a bit over the past 3 to 4 years. Take note, this is my personal experience, and please prepare yourself when doing anything unfamiliar for the first time.
I would also recommend blocking time off to do it. You need to be somewhere comfortable, familiar, and predictable. No surprises.
Happy Cake Day shortcake.
Ew, well, would y'all look at that?
Good. I believe small doses of psilocybin can help treat depression. Before anyone not familiar with micro-dosing gets up in arms. It's a dose that is lower than receiving psychedelic effects. It could possibly be used to treat smoking cessation and alcoholism. Anyone more curious on the subject, I suggest you watch Fantastic Fungi: The Wonderful World of Mushrooms. We are symbiotic to these organisms. We have a lot to gain in this partnership.
I microdose every month to help with migraines and depression. I've been doing it for around 6 months and have seen a great improvement in both.
Where does one get said microdoses?
Unclebens.
The blue eyes of the Freeman in Dune represent psilocybin. Frank Herbert wrote it in part based on mushroom visions.
Really? Is there a reference for that?
Anecdotally speaking, they increase my anxiety while I'm under their influence, but my baseline anxiety levels drop off a cliff for months afterwards.
A trip isn't supposed to be some protected space, it's meant to be consciousness expanding, which inherently induces anxiety. The focus of studies is on the after phase.
Someone tell Joe Rogan about this fascism. The police states of Australia are making policies to throw his freedom fighters off their scent. First it was ending mass shootings, then it was having less than 2,000 COVID deaths, and now it's testing mushrooms to treat anxiety? Where does it stop?
But only being allowed to get takeaway food from restaurants for a few months is literally 1984. Just insane that it took this long, so sad. I know someone who uses mushrooms. It's the only thing that helps them, and they've tried everything else. Goes to show you that if there isn't money, progress is beyond slow and sometimes worse, intentionally blocked.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.